Welcome to Knowledge Clip Research Skills. Today we're going to discuss evidence-based practice. What is evidence-based practice? Evidence-based practice is formally defined as the conscientious, explicit, judicious use of current best practice in making decisions about the care of an individual patient. Sounds a little bit complicated, but it means in evidence-based practice, we need to integrate three components. First component is we need to rely on clinical expertise. That means the experiences from clinical practice. Of course, the patients or the clients are important as well. We need to take into consideration patients' preferences, values, expectations, wishes. And of course, we need to integrate results from research, clinical research, but also sometimes practical and fundamental research. Best evidence is a very important concept in the scientific literature. We always talk about evidence-based medicine. That means that all the data, all the information that's going to be published in peer-reviewed articles need to be judged, assessed by experts in the field who are at least as competent as the researcher. So this is an important part of all scientific articles that are going to be published in scientific journals. Also, there are hundreds of scientific journals. Some of these journals have a high impact factor. Nature and Science are examples of high impact journals. That doesn't mean that all the other journals are less worthy, but you know, there is a little bit of competition and ranking going on in the scientific world. The peer review process and also before the formal publication, many of these procedures occur anonymous. So that's maybe good to know. BMJ, indicated on the left, stands for the Biomedical Journal, and Nature is, you know, one of those high impact journals. Many researchers, they would love to publish in Nature, but that's not that easy because of all the way how this scientific world, or you know, the way how people are judged, it's just a little bit competitive. Keep in mind, these days there is a lot of fake news. Everyone can Google information. But what you need to keep in mind, and I want to emphasize this because I see many students, they often have the tendency to, you know, Google information. You want to make sure that your source is reliable. Credibility is very important. You know, sometimes there are claims made by a person who is even not an expert in the field. You have to be alert. You have to be precautious what sources you're going to use. Okay, why is this important? What's in it for me? Keep in mind, at Pratice, we do a lot of practice-based research. Also, you're going to be a healthcare provider. That means your patient or your client has a clinical question or a serious problem that needs to be addressed. Of course, you want to provide quality care. You are the professional. So that means you need to question what treatment you're going to use and why you want to use a particular treatment or why you don't want to use a particular treatment. You need to support reasons for why. Also, you want to know if a treatment works. Does it work? Why does it work? Is it good? Could it be better? You know, there are always a little bit of limitations or things that work very effectively. And you want to know if it's optimal, which is of course related to it. Okay, where do I, the professional, find the answer? I think you know the answer. Science. Practice-based research, science, it'll provide you answers. also other experts in the field are able to provide answers. So, finally, research in daily practice contributes to the improvement and also to the innovation of healthcare professionals. Keep in mind that to create specific solutions for very specific problems is important as well, and they are also presented in your daily practice or in the daily practice. The next slide shows practice-based research at Fontes. We see a student and she conducted an experiment to address stress and anxiety in patients with Alzheimer's. So she tried to determine what are physiological parameters that predict stress, anxiety in patients with Alzheimer's. I don't know the details of the story behind, but her project was rewarded. Finally, your take-home message of today. You're going to work on a practice-based research project at the end of your study. You're going to work on it, you're going to write it down, you're going to make a thesis, you present it, and in this way, who knows, maybe you're going to contribute to evidence-based practice. Thank you for listening. See you next time.